Hi, everyone. My name is Hannah Burris. I am a behavior analyst here at Anna Shaw Children's Institute, and I am here to talk about some common misconceptions in applied behavior analysis therapy. So where did we come up with some of these misconceptions? A lot of these we have heard through Facebook groups, parent questions during some assessments. We've read them on blogs, or we have even had them reported from other professionals, such as our doctors, speech, OT, PT, teachers, about some concerns that their families that they work with have about ABA. One of the most common misconceptions that we hear is that behavior can be changed immediately. Now, it's important to know that BCBAs and RBTs are not magicians, so it does take time to change behavior. A general rule of thumb that I like to tell all of my parents is to think about how long the child has had to learn that a certain behavior works for them. For example, if a child has learned for an entire year that hitting gets what they want, it's going to take a good amount of time to reduce that behavior and for them to learn to replace that with something else that'll work better. It's also important to know that ABA is not a type of therapy that you can just have 30 minutes once a week. It is definitely more an intensive therapy. So it's very common for sessions to be several hours long, several times a week. And the amount of therapy that each child needs will depend on that child's specific needs and the family's needs. Another misconception that we hear is that behavior is changed to fit neurotypical norms. At Anna Shaw, we understand that every child has specific needs. So the goals of ABA are going to be tailored to each individual. So we might be working on functional communication training with everyone, but how that looks is going to be different for each child. For one child, we might be doing that with verbal language. Someone might need sign language, picture communication systems, AAC devices. We're just going to strive to find whatever method is going to be best for that child. We also may work on these play skills or attention skills, and we're doing this not to force the child to behave a certain way, but rather to expand their skills. It's important to know that the goals are not to change the child's personality. We want to teach skills that promote a successful life, whatever that means to that specific child and their family. We have also heard that ABA will cause physical pain to the child, whether this is through eye contact, fine motor skills, gross motor skills. Yes, we do use these tools and we do work on these skills, but we're looking at how does it affect the quality of life for that child. So can they respond when their name is being called? Can they get themselves dressed with their fine motor? Can they zip up their jackets? Can they button their pants? Can they demonstrate the abilities to function on a day-to-day basis for their gross motor skills? So can they complete showering routines? Can they do cooking routines? Can they sit and play with toys functionally? It's also important to know that BCBAs should be collaborating with speech, OT, PT, feeding therapists to make sure that they are also doing what is best for that child. Something that some of our families worry about is that, oh, the BCBA is going to make all of the decisions in the plan of care. And BCBA should be collaborating with their clients. So we should be sitting there talking about what skills are important to that kiddo, what skills are important to that family, and what are some actually feasible goals that we can obtain. There are parent support sessions that should include discussions and teachings of ABA practices and techniques. So this provides parents with a time to ask questions and ultimately determine what they are willing to commit to. We also have families and parents hear the term consequence, and in ABA, consequence does not mean what it means in typical day-to-day life. So it just simply means that it's something that happens right after a behavior occurs. So in ABA, we have what we call the ABCs of behavior, which stands for the antecedent, the behavior, and the consequence. So an antecedent is something that happens right before a behavior occurs. For example, a child might smell some cookies. So then that might cause the behavior of asking a parent for a cookie. And the consequence is the parent gives the child the cookie. So in this example, the consequence was just what happened right after that behavior of the child asking for a cookie, which was the parent gave the child the cookie. We have also heard and had some concerns expressed that clients, what they learn in clinic, they won't be able to do it at home. So As a BCBA, we will plan for generalization to make sure that our kiddos are learning and able to do these behaviors through multiple environments, multiple settings, multiple people, and even multiple behaviors. But it is important that if caregivers can implement the plan at home and have good carryover, then the progress will be a lot faster. We also provide parent support meetings that will work through practice examples and that actually provide one-on-one practice to those parents so they can have more confidence implementing the plans at home. We also hear that ABA does not work for nonverbal clients, which is simply not true. We focus a lot on communication skills. So we might work on receptive language skills, expressive language skills, verbal and nonverbal behavior, and we do all of this through functional communication training. And again, this will be specified to each child. So we may be using American Sign Language, we may be using AAC devices, we may be using verbal approximations, or even picture exchange communication systems. One of our last misconceptions that we hear a lot is that ABA is going to make behaviors worse. Now, it is true that we might see a behavior get worse before it gets better. And typically this is occurring because children are frustrated and it's hard to learn those new skills. And so we might see an intensity or an increase in certain behaviors because what they were doing is no longer working, and learning this new skill is a little hard. So yes, we may see an extinction burst, which is that peak of the behaviors getting a little worse, but then we typically see the behaviors decrease as they are learning their new skills. So a last little thought that I will leave with you is a quote by Catherine Lord, and it says, "Any good therapist, whether ABA or not, will try to figure out ways that build on an individual's child's strength, that use their interests, but that allow them to participate in society and that will give them the most choices." That's what we want. We don't want the best behaved person. We want a person who can do as much as possible and get as much joy as possible out of the world. Again, that was Catherine Lord, PhD. Thank you.